Sited at the KK Women's and Children's Hospital, the Department of Psychological Medicine provides ambulatory and liaison psychiatric care for women and children. Our position here in the front line enables easy access and early intervention for both mother and children. Women receive specialized care for peripartum and preconception care of mental disorders as well as cancer-related disorders. Recognizing patient preferences, we offer modalities such as art therapy and mindfulness-based interventions. Music therapy also benefits particularly the young ones who struggle with coping with cancer and neurorehabilitation as well as various chronic conditions. Collaborating with neuroscientists at the A-Star, with the Department of Biomedical Engineering at National University of Singapore, we've been able to understand how maternal health impacts on infant development, validating our work in this area.
Well, my key focus for service is to provide timely intervention for children and adolescents admitted to our hospital using a multidisciplinary approach in terms of working with children and their families and agencies in the community. We also have an outreach team that works with schools from the eastern zone of Singapore.
At KK Hospital, the holistic approaches we use include weekly meetings, case conferences, phone calls and emails with respective professionals involved, just so we could coordinate care for the patients. A lot of times we also liaise with school counselors and external agencies just so we could get better support for the patients. We also typically involve family in the treatment process, just so families would know what to do to support patients outside of KK Hospital.
The challenges faced by children with intellectual disabilities include the complexity in their diagnosis and management of coexisting mental disorders and behavioral disorders. The challenges are also common when we work with multiple caregivers. In Asian context, it's not just the parents who are main caregivers for children. Often we have family helpers and also grandparents who are involved in close care of children. So when managing these children, we have to take into context of providing the management strategies to the whole family. We see a lot of children with neurodevelopmental disorders like attention deficit hyperactivity disorder. These children face different behavioral challenges, and also it is associated with increased stress levels for parents when managing the behaviors of children with these disorders. To overcome this, we provide parent-child group therapy, which involves managing parental stress through mindfulness and also teaching parents parenting skills for managing these children.
There's a shared belief in the department and the service that in order to engage and help young people, children and adolescents, we really have to engage families as well. One of the hallmarks of a child and adolescent psychiatry service is a service that is holistic but also family-centric in its approach. Singapore is a very busy place. We're very competitive and we work long hours. Kids go to school and stay in school for longer as well. And in addition to that, we're a very connected society, so we use our gadgets and we use our social media. And I believe that we're more connected sometimes to those things than we are to our families. And one of the reasons I believe that we see more and more kids with emotional difficulties coming through our doors.
As a case manager, basically we coordinate care. We are the ones who assess patients for their mental health needs. We refer them to resources, where relevant. Other than parenting workshops and support groups, we also conduct counseling as well as psychoeducational sessions with patients to help them cope with their condition. For many patients, talking to somebody caring and supportive could help them to, gather their thoughts together, to get to know what is the problem about, and also to feel re-engaged with their own internal coping resources.
When we collate the information on patients that we have seen in our department, we find that roughly 8% screen positive for probable postnatal depression. And given that in KK Hospital we have something like 14,000 deliveries per year, that works out to quite a substantial number of women who have this problem. We also find that of those who accept treatment, about 80% recover and can get well. We've also noticed a particular problem though. We found out that about 2/3 of those who screen positive for probable depression actually decline or have difficulty accepting psychiatric help. KK Hospital is the only hospital in Singapore that caters specifically to women and to children, and so we are the only psychiatric department in the country that caters, specifically to these populations. I think that the vision for our future lies not only with the clinical aspect of things but also with research, because I think that where we are cited gives us unique opportunities to learn new things about how we can advance psychiatric healthcare in these populations in Singapore.